Welcome to hematology. Come on in. So we're going to check in to Hemoglobinopathy clinic here at the front desk. Hi, my name is Nicole. I am a registered nurse at the Hemoglobinopathy clinic. So we are a busy multidisciplinary clinic. We try and see our patients about once every 6 months or so. When they come here, they're seen by a hematologist. They also get like a TCD scan done, which is an ultrasound of the vessels in their heads. We also do a breathing test, so they're also seen by respirology, a lung doctor as well. We also try and get them in to see a dietitian and social work and whoever else needs to see them, and try and be like a one-stop shop for the patient. So yeah, that's our clinic. So in here we've got TCDs. This is where the TCD magic happens. Step 2, then they go into a room, which are all full right now, but and then everyone comes and visits them there. And so as a nurse, I feel like an airplane person sometimes, like, okay, this person over here, I guess, yes. Like so. Just directing people into different places.
I'm Dr. Gurpreet Singh. I'm a pediatric hematologist at Alberta Children's Hospital. It started, I'm not exactly sure of the exact date, but it's been almost more than 10 years. My predecessor and senior colleague, Dr. Mike Leaker, was the visionary behind this clinic. His vision and collaboration with other colleagues from respirology team, collaboration with the neurology team on the adult side, and other parts of our team, which included nurses. So it was a collaboration and discussion with them, and of course our families, who would benefit much more from bringing all the collaborative effort in one clinic instead of having them go to different clinics in different time and thus missing appointments. So the clinic involves multiple fields and multiple departments, and collaboration among them. The key part of our blood is what we call red cells. So the red cells are important because they carry oxygen in the body. The mechanism that they use to carry oxygen, or the vehicle that they use, is hemoglobin. So hemoglobin is the chemical that binds to the oxygen and takes it to different body parts so that we can have that energy. So any disorder that affects that hemoglobin is known as a hemoglobinopathy. Often screening is offered in populations who have a high incidence of a problem, so that you can detect it and kind of do something about it. If the incidence or the is quite low, then a lot of people would not screen for those disorders. But there has been a significant increase in immigration as general to Canada. A lot of people who are affected with hemoglobinopathies come from different parts of the world who have immigrated. There has also been an increase in the interprovincial migration. Calgary is an important center for providing a curative therapy called transplant for these hemoglobinopathies. So we have seen a significant amount of migration to Alberta to access that transplant. Our visionary, Dr. Leaker, and a visionary among the transplant team, Dr. Gilcher, have collaborated very effectively. We have close collaboration with them in terms of understanding when to do transplant, when to offer. So our patients would often, we would discuss with the option of having a curative therapy like transplant up front. Here we are very proactive, knowing that transplant, especially if done from a sibling that is matched, is quite successful based on the protocol that is being used here at our center. And so we often would have that discussion up front rather than wait for families to ask. So sometimes I think we are all kind of working in silos separately from each other, providing the care. And although we can talk to each other, but I think having a little bit more of collaboration and communication when we are providing care for the same patient, I think that probably is the key that goes a long way in establishing such a multidisciplinary clinic. And typically, once the whole clinic is finished, at the end of the clinic, the whole team would sit together and kind of go through the plan for each patient so that we have it documented. And with Connect Care in place, typically we put it in a summary so that the families can have it as well. And that is given to the families. So some of these initiatives were also part of, because everybody got together and could put their minds together, then they advocated for the newborn screening as well. So typically for our patients who are thalassemia and dependent on blood transfusion every month, they are seen every 6 months. And those who are sickle cell disease, again, those who have a severe disease, they are seen every 6 months. And those who have a less severe form of sickle cell disease, they can be seen every year. Step one is to get together and brainstorm and get a bit of feedback from the families. So I think patients can be good advocates and they can tell you, is this something that you need or not? So if a group of physicians is interested in that, I think the first step would be to talk among themselves and then asking the families in their clinic that would this be of interest. It might be a simple quality improvement project and that feedback comes from the families. I think then the resources can fall in place.
One of the nicest parts about getting to do a multidisciplinary clinic like this is getting to work alongside colleagues who you usually get to work with very closely. Every few weeks I get to go and see my hematology friends and work alongside them, try and take care of a complex population of patients in the very best way that we can. So I think that's a really neat advantage as a physician, but it's nice to forge those relationships over time.
And our team is amazing. I mean, it's just kind of decreases that burden a huge load. When I go to a hemoglobinopathy clinic, I usually go, it's like, oh, we will interact, we'll talk. There's always help around. If I can't do something, our nurses will come up with a solution. If I have a problem, our respirologist will give another advice. So it's something that we all get together and we can do problem solving much more efficiently. The ability to understand each other, the ability to work together, the ability to kind of have that dynamics, that functional dynamics that we have within the team, I think that's pretty good.
What's your favorite part about this clinic then?
I think it's just like getting to see the kids grow up. Sickle cell is a chronic disease, and so it's something that they have for their entire lives. And so you see them, if it's flagged when they're first born, all the way until they turn 18 and transition into the adult side. Like, it's sort of really neat to see them grow, and I think that's pretty amazing what we're able to do. You see their journey the whole way, which is really neat. So
yeah, it's a really neat and privileged position that we have to get to follow families for a long time and get to know them really well. As patients are doing better and better with sickle cell and because of some of the newer treatments that we have, I'm really hopeful that we're sending much healthier patients to adult care who will get to lead long and healthy lives after they transition.
Yeah, no, we have lots of family, a connection with them, and sometimes when it actually starts to show is when they're about to transition to the adult hospital. I think that is the time when they kind of bring up that emotion and say, hey, we've been here such a long time and we didn't even realize that all this care that we've been getting is just excellent. And I think to see the patients who are transitioning, going into, say, a college or a university, or to be able to live their life as they would do even without having sickle cell disease. And when we get the feedback, the positive feedback of how good the care has been. So I think those kind of stories, when they come back to us, those are very heartwarming, encouraging,